Various methods are adopted to enhance quality of life of the elderly like wellness, social engagement, cognitive stimulation, and emotional support, integrating technology, finance, infrastructure, and volunteerism. Let us listen to Dr. Vivek Redkar regarding the changes that has occurred in this field recently.
Doctor, at this point, the age today is you and me tomorrow. That's a reality. Well, what is important for us, care or cure, when it comes to old age, is a very important topic that probably we need to address upon, because you and me don't get to decide for ourselves when it comes to the last stages of life. So that is a very delicate end of life care situation that probably all of us will go through. So you can dwell on that. Thank you.
Respected chairperson, excellent organizers, limited quality audience, and President Ashokan, who has given me chance to present this. My teacher used to say, your presentation should be like beautiful girl's miniskirt. It is long enough to cover the subject, but short enough to keep the interest. I'll finish it in 20 minutes. Now, great respect to Shom Madam, who has shown how she has treated her husband, and great salute to her. Also, Dr. Kiran has made my job very easy. And now I would like to tell you some facts, some practical things. Now people, young doctors are interested in adult and emergency medicine, pediatric medicine, but why not they are interested in medicine, geriatric practice, where conditions are favorable to them like cardiologists, because 30 crores of the people will enter, 30 crores of the people will enter in that geriatric age, and this has already been discussed, so I will not repeat my slides, because what is the life expectancy and all that, and how geriatric population be more in India. So nowadays there is a, when I treat a geriatric patients, as a physician, a senior physician in the village, there is a tug war between experience and technology, between junior and senior MD doctors and geriatrician. Young geriatrician now treat patients with eye stethoscope and bedside echocardiography with help of artificial intelligence, and seniors in the villages with gold standard clinical examination. So they know anatomy and physiology and biochemistry on the day of admission of a geriatric patients. So we should treat geriatric patient with experience for technology. That will be the rule in the future, because in the past we have been taught like that. Just see the site of murmur, type of murmur, intensity of murmur, pitch of murmur, duration of murmur, distribution of murmur, all thing has gone. Now one probe of echocardiography will be knowing you what is the anatomy of the patient. Now my geriatrics venture story goes like what exactly said by Dr. Kiran in a panel discussion. In 2000 we have started geriatric OPD in the Western Maharashtra and in Goa, because my village is sandwiched between Goa and Maharashtra. In 2005 we launched Azor. The name is given by my wife for this, because Azor is home of a parents and grandparents. Now here we have done a preventive venture. Then in 2010, we have established a Dilasa, that is a curative center, and in 2015, terminal care center. I know that WHO definition, health is not merely absence of disease, it is a physical, mental, social and spiritual well-being. And we are trying in all these three centers the same thing. Now this is our center for diagnostic care. Now comprehensive geriatric assessment is a key consideration, where you have to evaluate patient capacity, relevance of investigation. If it is not changing your treatment, don't do it. Input from the closest relatives. I think all these points are covered. So I will cover only those points which have been not covered since morning. This is our Azor Preventive Care Center. And here we added medical tourism center, because sometimes when you do Holter monitoring and ambulatory BP, you can do it together while patient is enjoying medical tourism. So we are doing that in our district because it's a beautiful tourism district, Goa as well as South Maharashtra. Now, important presenting problem are A to Z. I will cover only A, B, C, D. Now, these are the problems each and every geriatrician is facing: cardiovascular disease, respiratory issues, neurological disorder, and every system disorder. I feel that we geriatrician treat a person, while this super specialty treat only one system. So, what are the problems we faced? When patients started surviving more than 80-85, they are bedridden. So, problem of motion and urine voiding, all those typical old age problem of a bedridden patient came. So, we have started with one medical care home, and then our problem was where to bring people to serve them. So we have started with GSICON Sansthan nursing assistant course, which has been planned by the government, and we have trained almost 280 staff so far in last 10 years, so that they have got job as well as people have got some nursing care personalities to serve. Now, after this, we decided that we should go for a research. We form a Redkar Hospital Research Center on the Goa border. It is a village area in Pedne. Here we have done a different research. But my research venture in the geriatric practice in the remote places of India, my fear was my abstract introduction and result. This I was very much worried. So, we are in search of research for IHD, hypertension and diabetes, which world is facing now. And these three problems, key insight from our combined monitoring was, we have done Holter monitor, ambulatory BP, continuous glucose monitoring together in the same patients, and seen for diurnal variation and how it fluctuates day and night. This simultaneous approach enabled us to comprehensive understanding of correlation between physiological changes and their temporal variations. So this is a patient, how he looks, and if once he puts a shirt, he can go for medical tourism while undergoing is a Holter monitor, ambulatory BP and continuous glucose monitoring together. So this is a new concept. So finding of conclusion of a Holter monitor was it was a simultaneous monitoring and importance of chronotherapy. That is, tailoring medication timing is crucial for geriatric patient to manage hypertension effectively. Key observation was night deepening, properly managing nocturnal blood pressure dipping is very, very important, which is not there in most of the geriatric patients, while morning surge was very high blood pressure. So we hypotheticate that medication for hypertension should be given at night, because most of the catastrophic events, they happen early in the morning. So simultaneously rate rhythm of the heart should be taken care of, because we are doing Holter monitor and ambulatory BP together in the same patient on the same day. And these are the tachyarrhythmias we got. These are the all possible tachyarrhythmias. We have formed our one format of arrhythmias, how to treat. We have divided it in narrow QRS, regular rhythm, irregular rhythm, narrow QRS, wide QRS and wide QRS, irregular rhythm. Now it is very difficult, simple to treat bradyarrhythmias because patient gets syncope, and once you do pacemaker, problem is solved. But in tachyarrhythmias, it is very difficult. So these are the all possible arrhythmias in the world and specific treatment for that. You must know this actresses. Now, I feel young generation will know that Madhuri Dixit, where all these AVNRT, AVRT and all those are treatable. But irregular rhythm with primary pulmonary hypertension, which Madhubala got in a KM hospital, see, there was no antiarrhythmic drugs that time. So this I made it interesting for my students. Not, but of course you can take some treatment module on it. Now we have presented this paper in a different international forum. I think I should not show this slide because this you can go and I will send this presentation to you later. Now, this targeting nocturnal hypertension in type 2 diabetes mellitus, systemic review of published randomized control trial, the right study, we have presented a paper. Then we have presented paper in American Diabetic Association because it is a revolutionary concept that you do 24 hours blood pressure arrhythmias with simultaneous ambulatory blood pressure monitoring and Holter monitoring in type 2 diabetes patients. This is my village, sandwiched between Goa and Bombay. I am in Maharashtra, and it's a beautiful place like Kochi. But now mines have come in our village, and this has ruined our village. All beautiful scenario has gone. This village has been ruined. Then what to do for my senior citizen home where they have been attacked by pollution? So my focus area was respiratory health in geriatric population affected by mining and occupational pollution. So key concern was exposure to pollution and mining and respiratory disorders over decades. A study is almost we are doing it for last 35 years, analyze almost, it's not 4,000 individuals working as a miners and drivers. We have done pulmonary function test of almost 4,000 people and come to the conclusion that patient has got obstructive as well as restrictive heart disease, their functional residual capacity has increased and they are suffering from different respiratory disorders. Now, we cannot change the government or mine owners that you do good roads and give some pollution, how they will do it. I feel that politics is the inborn error of genetic metabolism. They will not do anything. But what we did, how to solve this problem? We have made a nasal mask. And this nasal mask, we have asked them to give to our mine workers. But they are refused. And this is costing around 8 rupees. But general practitioners started giving them steroids, oral steroids. And they addicted to it, started taking steroids. And the young generation of my village and that Panchakroshi has developed diabetes, early diabetes. So we have presented that paper, checking their diabetes, early diabetes, the causes, and we found out that most of them were taking steroids. So health implication of diabetes induced by misuse of oral glucocorticoids in the minors with compromised lung functions, we have presented in IDF. Now, this is a mouse is a problem in GD. Mouse is, elder lady. One is a motion. Indian patients are very emotional about motion, appetite, urine, sleep and snoring of a partner. So this is the most neglected topic in geriatrics is the sleep apnea. So we have started studying sleep apnea and conducted trials and patients, we have done sleep studies and study parameters where sleep study was correlated with blood pressure monitoring and continuous glucose monitoring at night. A total 1,000 suspected patients we have evaluated. No patient were diagnosed with moderate to severe sleep apnea. Almost 110 patients were diagnosed with severe sleep apnea who need even BiPAP or CPAP immediately. Now, significant improvement was observed with CPAP therapy with a quality of sleep, hypertension management, diabetes control, paralysis. This is secondary sleep apnea because of palate paralysis. Now, we presented this patient of sleep apnea and systemic review of meta-analysis of ongoing trials in the World Congress of Neurology in the United States. So next come in my life is a 2-minute story of methylene blue. So my village is near seashore in the mine area, and people from China used to take these mines and this material back to China. Now when this COVID came, all these China people on the boat have been examined by my little bit smart medical officer without using PPE kit. Then we have quarantined him, and then we have got a problem how to treat this patient. Now addressing COVID-19 parameters in old age and medical home, because our people will be having high morbidity and they will succumb first. So our team was in search of what to do for these people and how to manage them. So we have found out what is going on in the world to treat early COVID infection. So in Italy, we have presented this patient that whatever available is not sufficient and we have to do something other than doing invasive and non-invasive ventilator and giving some drugs which are not up to the mark, giving oxygen. So we are in search of some drug which is economical, minimum side effects, must reduce oxygen requirement of patient, and can be treated by all three routes. But there was one drug which we found out was methylene blue in COVID. So it has reduced percentage of oxygen which is required per day to almost 50%. And the way how it acts, so it acts on the spike protein, it kills viruses by oxidation, it makes alkaline medium of a cellular cytoplasm, and they cannot survive in the acidic medium. So these are the different doctors in India, like in Anil Patel from Surat. They have presented this, they have carried out this research work and found this methylene blue is far better than remdesivir as a virucidal, as an anti-inflammatory drug, antiviral drug. And then nobody accepted it because ultimately it is a 10 rupees ampule, very cheap, very economical, and people are crazy about remdesivir. So these are the two people from the Gujarat, only 2 minutes, two people from the Gujarat who has done research work. They have done the idea, the two nostrils have taken the swab. First nostril they have put up methylene blue and taken a swab after 3 days, and second nostril again they have taken, and they found that this rapid test is negative in the first nostril, and they have started using it. It's a beautiful drug because it has no anaphylaxis, and in between we have found out idea of oxypap which has come, which has saved life of patient. When we give methylene blue IV with oxypap, results were extremely good. This is the way we treated encrustations when in the COVID patients. Even in ARDS, this type of encrustation is on larynx, which has got a simple solution where 8 gram of salt can be dissolved in 250 ml of water, and we can literally treat this patient, and BiPAP will be effective because his encrustation will go with nebulization of these salt fumes. So advantages were taken of the side effect, and really I feel this drug is an excellent drug, but world will not accept drug of methylene blue for COVID or even for respiratory infection in geriatrics, lower respiratory tract, unless we do qualitative and quantitative analysis of methemoglobin in the blood during admission and happy hypoxia. So we have done that research in Krishna Institute of Krad. We have done quantitative analysis and qualitative analysis of methemoglobin, and we have presented a paper on methylene blue on hospitalized patient in the American Society of Tropical Medicine and Hygiene. So after that, even post-COVID era, we have treated patient with Cox fibrosis. Then these are the excellent results we have got, and see the drug which even is effective on wrinkles with the secondary infections and repeated viral infections. And this we called it as a Marilyn Monroe drug, or some you can call it Devanand Madhubala drug. But this is an excellent drug if you give it to a geriatric patients. And recommendation for MB in geriatric practices: infection of upper lower respiratory tract, pulmonary fibrosis to heel fistula, skin infections, osteosarcoma, and research is going on in this drug. So this is important point to present this drug and to tell this drug to you. And you cannot of course give it in patients who take tricyclic antidepressants or G6PD deficiency. And then we have done a research on Covaxin in a adult patient as well as a normal individual. ICMR has selected 12 hospitals in India. One of the hospital was our hospital, in which we have done a trial on these 4,000 patients. And we have found a very important result that even in geriatrics, it works well. And there are no side effects as far as compared with the young generation. So I feel that if somebody thinks that he should do research at a village level, Geriatric Society of India and these all stalwart people will help you. So if most of the, of course, most of the physicians might have visiting this place for taking some guidance. So I would like to take guidance of you people, and if senior citizen who needs admission from day one, he must be involved in a research protocol, enrolling his name in your research activity, and patient should give you written consent for the same. Now, you can form a team of your like-minded doctor friends through Geriatric Society of India interested in research to do multi-center trials. We 98 physicians of India carried out methylene blue study in COVID pandemic. I think this should be a message home that we should take help of Geriatric Society of India, and I am attending this conference for the first time of Geriatric Society of India. So I'm not going through the slides, my time is over, I know there are only 52 seconds remaining. But I feel that strategy to enhance geriatric healthcare and preventive medicine is involve young relatives in preventive medicine which are inherited. Second, adapt existing hospital for geriatric care. If your next generation is not going for a geriatric practice, I mean any practice, you change your hospital or give part of your hospital to geriatric care, some time of your consultation to geriatric care. Collaborate for multi-center research trials. Promote body and organ donation. So key message is engaging families, adapting facilities, and then promoting this geriatric practice is very important. So what a remarkable gesture by the doctors, honoring an organ donor with a last salute acknowledgement in immense contribution by giving others to second chance at life. We are doing this regularly in our all three hospitals, and we are convincing the importance of it to a geriatric hospitals which are in the villages as well as in the cities. So, as an experienced doctor, I have done a lot of mistakes in treating my old patient, but I remember great line said by Chanakya, I have to learn from the mistakes of others because my life is not too long to make my own experience, and I am here to take some of your guidance how I can go ahead and do my work in my villages. Thank you very much. I finished it in time.
Can we take a few questions from the audience?
Thank you, Dr. Vivek Redkar, for that great talk. My focus is on the research element that you are encouraging us to do. We in India have not been very research-minded generationally. We have been excellent clinicians, but we haven't been documenting our work and doing long-term studies or follow-up. So first thing is that the usual research excludes patients above 60. Drug pharma companies usually don't focus in the non-white and elderly population, so we do not know the effect of drugs. So thank you for that research initiative. And the second point was that research can be done at at any center wherever there's a person with a research mindset, and does not have to be from academic centers of excellence, because our catchment area is 70% in the rural population. So I think the study on methylene blue and the effects of it, perhaps we could do a randomized control trial. I knew you did that 2-nostril test, but perhaps the effect of methylene blue, because it's so cheap, no drug pharma will be doing it, but maybe the ICMR could, take it further forward if you find there's some proof of concept studies in that.
Yes, the same thing happened. Nobody was interested to go ahead and make this drug. That's the problem.
Exactly. It doesn't sell to profit them. So that's why they will not sell. But for us, we need something that's cost effective. Like exercise, it's the wonder drug, which nobody talks about, because nobody's selling exercise apart from Nike and Adidas selling shoes. Thank you for that. Those two important concepts, research and, methylene blue. Thank you.
Thank you, sir.